I'm going to start the recording, and I'm just going to introduce myself so that you know a little bit about me. So I'm Imelda Williams, as you probably realize already. I'm originally from South Africa, did my master's in the UK and also worked at a university there, and then came to Australia. So my main focus has been in image interpretation. And at Monash University, I teach in the undergrad program as well as this postgrad course. And even in the undergrad program, my main focus is that of image interpretation. So for this unit, I'm the course convener and I'm also the chief examiner. And overall for the whole course, then I'm the course director for the image interpretation certificate. Okay, so I will let Tony just introduce himself as well.
Thanks, Imelda. So I'm Tony Smith, obviously, and Imelda's the boss. I do quite a few lectures into this unit, so you'll see me on screen a fair bit of the time. Recorded lectures, I should say. So they're Zoom recorded lectures, and so they're not live like this session. My background is that I'm also a radiographer with, I guess, many years experience and worked a lot of time. Well, I worked in both private practices and public hospitals in New South Wales, and spent a lot of time doing accident emergency, plain radiography and CT mostly. I also worked in university for over 30 years, concurrently with doing clinical work as well for a lot of that time. And I was based at the University of Newcastle. So I taught into undergraduate programs as well as taught research to radiographers, but also other health professionals as well. So I too, like Imelda, have a strong background and interest in image interpretation, and very keen. I mean, Imelda and myself are both very keen to actually promote radiographers doing more in terms of interpreting images, but so long as they can actually do it well and do it accurately, which is the importance of getting some education so that you become an extra set of educated eyes looking at images and passing on your opinion to appropriate people, so other members of the healthcare team, be that radiologists or referring doctors or maybe nurse practitioners in some cases, or maybe ED physiotherapists and a whole range of members of the interprofessional team. So you'll hear from me a fair bit over the semester, and Lauren Kusher, also in 4502, will have some contact there as well. So that's enough from me for the moment. I'll go mute again and hand back over to Imelda.
Okay, thanks, Tony. So I'm just going to go over the introduction for the unit. I don't know whether you've had a time to look at the Moodle site and just make sense of what's there. I hope you have, so that if you have any questions, you can always ask us as well. So I'm just quickly going to share my screen and minimize this. Okay. Okay, so we have introduced ourselves, so you now know about the two of us and our background. And I just want to acknowledge that Monash University recognizes that its Australian campuses are located on the unceded lands of the people of the Kulin Nations and pays his respects to their elders past and present. So the main way that you can communicate with both of us is via our email. As Tony has said, he's a sessional, so he's not always, at a computer. And myself, I teach in the undergrad program, which means sometimes in the lecture rooms I can't answer calls. So the best way is to communicate via our emails, and I've given those emails as well. This was just the Zoom invitation. What I'm going to do, because the two of you are quite new to the program and I think to Monash University, I'm just going to stop share and then just go over the Moodle site and just highlight what some of the important things that you need to be aware of. Okay, let me just see. Right one? Okay. Okay, so you can see at the top, we've got all these tiles. So there's the unit dashboard. And then I'll just firstly go to the unit information page, which I hope you've had time to look at. And under unit resources, there's a direct link to the handbook. So if you want to have a look at the unit handbook, the learning outcomes, the assessment criteria, and so forth, there's a direct link for that, and then also a unit preview. Now, in terms of the timetable, you will notice that you can only see week 1 at the moment. We release the material on a week-by-week basis, and that is to scaffold your learning so that you are not overwhelmed that we release everything at once. And we also, normally when we release the work, we would also send notification what you should be focusing on for the next week as well. It's also quite important with the timetable to take note of when assessments are done so that you can prepare yourself for your assessment. So put that into your diary. Now, I'm just going to go to the library reading list. So this is the reading list for this unit. And the essential reading includes I'm sure we had more than that. But anyway, one of the books that we use is the book of Otto Chan, and that is available online. And we normally would, in a weekly basis, actually include which chapters should be done in the book, and we would link it to that book. There's some other books here that we quite often refer to. So there is the book by Begg on accident and emergency x-rays. There's another book on anatomy in diagnostic imaging, and this orthopedic book, which is quite a thick book. It looks like a big fat Bible by Greenspan. It's got much more in than, for example, with Otto Chan. And then there is another book, Interpreting Trauma, as well. And then this book by Raby, we actually quite refer to it quite often. And then this is a UK making the best value of clinical radiology. Now, what you will notice is that when it says view online, it means all of those books are available as an ebook. So you can open up that book yourself. You can download chapters from it. You can read it online as well. And that's why we can link it to the specific pages. So this is a guide of the books that's available. I just hope I can see. Sometimes this blocks my screen and I can't see beyond this. I'm just quickly going to stop share and then share again. Sorry. Before I do that, sorry, let me just stop share. I first need to get out of the reading page and back into the unit. Okay, there we go. Okay, so that is the reading list. So basically, you don't need to come to any of our libraries to get hold of those books. And then there is the assessment summary, which I will go through during the PowerPoint. We also have an image interpretation workbook that was basically written for our department. And we also refer to that book as well. So there's direct links to that image interpretation workbook. There's the learning outcomes for the unit as well. And then when we go to the other tile, so the schedule basically will show you what is available. So at the moment, you can see getting started is available and week 1 is available. It also shows assessments and the dates when it will be due. Now, under learning, so I'm just going to go over getting started because that is actually quite an important tab where we do post some of the information. So under getting started, it has got, for example, there will be an ISAP case that you're going to do, and I'm going to talk about the ISAP case a little bit. The ISAP case will be released next week, so there will be a recording and an introduction about that as well. The ISAP case has 2 parts to it. You can see there's a clinical action plan and there's a comparative report. So basically with the ISAP case, you get a scenario, you get images, and then there's a couple of professional issues that you need to address, and you address that with your clinical action plan. Once you submit your clinical action plan, and you can see this is a Dropbox for the clinical action plan, due on the 23rd of August. Once you submit that, an expert report becomes available. That report will only be available if you have submitted your CAP report and once the deadline has been reached. So seeing that the CAP report is due at 5 to 12 on the 23rd of August, the expert report becomes available on the 24th of August. And then once you receive the expert report, you then need to compare and contrast your CAP with the expert's report. And then there's certain criteria that you need to address with the comparative report. And that's due a week later. It's much shorter, so it's only 500 words. And you can only submit that if you have submitted your CAP report. So that will be your first big assignment that you need to do. Then you will have an exam. I'll talk later about that. And that exam is in October, so we'll tell you more about that exam. And then there will also be, I see the clinical portfolio is not showing up here yet, so I'll have a look at that. So that is under getting started. Under the assessment tab, you will see that the CAP report shows up, but not the CR report. And the reason for that is the biggest weighting is on the CAP report. The CAP report is 1,500 words and the CR report 500. We provide joint feedback on both reports, and that is then submitted via the CAP where we give you feedback. So the CR report doesn't show here as it got a 0 weighting. The 30% weighting is sitting with the CAP report. There's your online exam and then also the imaging portfolio. So that's what you can see under assessment. Forums is our communication that we have. So normally we post notifications from our side to the students, and you can also respond by posting your questions on the forum. I would suggest, though, if it's something that you are directing specifically to myself and Tony, that you actually email us. You can post it on the forum, but also email us because we don't always get those notifications. And then we are unaware that you've posted a question under a forum. So rather email us when you have got a specific question. The other tab that's really important is the support tab right at the end, and that is the support that the university offers to all of the Monash students. So if you need some advice in terms of if you're struggling and you need some advice around academic success, there is a link. Learn HQ at the moment is very much concerned with AI, so there's a lot of support there. You're probably aware of the explosion of AI and how serious universities are taking it. And then if you need a learning advisor, there's academic, if you struggle with English, and then also the student academic integrity, which has to do with plagiarism. And then the other thing is the short extension and special consideration. So a short extension is allowed. So say, for example, with your ISAP case, something happens, you need a day or two to finalize your reports. You can apply for a short extension. So the maximum extension that you can get will be 2 days, and you don't need any supporting evidence for that. Normally, that is approved by a team outside of the department, so I'm not involved with that. I'm just informed afterwards that the student has an approved 2-day short extension. So say, for example, as I showed you, the reports, the CAP and the CI report, the deadline is on a Friday at 5 to 12 in the evening. The 2-day extension only allows you until the Sunday, 5 to 12 in the evening. So it includes every day of the week. So it's not that if you don't submit it by the Friday, you only need to do it now by the Tuesday. So it includes the Saturday and the Sunday as well. Via this link, you can also apply for a formal special consideration. So say, for example, if you're really sick and you know 2 days is not going to be enough, then you can apply for special consideration, but then you will need supporting evidence for that so that it can be considered fully. Normally, they will then engage with the course convener or the chief examiner to approve that. So there is a direct link there if something happens and you need an extension. Then there's a link to the library. There's a link to citation and referencing, and also information around rights and responsibilities. Now, Monash Connect is quite often the route to go when you have got a central question you want to ask. And then there is, if you click on this, it will provide you a full range of student services as well. And then there's disability services where you can register as a disability if you need extra time for exams, for example, and things like that. If you find that you have an issue with your computer or internet and you maybe need to busy writing an exam, the best thing to do is also to include me in any of that, but there's eSolutions is here. So if you struggle with access to the Moodle site, there's a direct link for students as well. So this is the one that would be most appropriate under technology, and the rest is just Malaysia. Okay, so I just want to ask if there's any questions around those Moodle sites, because it's maybe a little bit different than what you've been used to. Are you okay with that? Have you had a look around, Lauren?
Yeah, I've had a bit of a flick through. Thanks for explaining it, because I was a little bit lost. I was looking at a different part that didn't have all that stuff yet.
Yeah.
So I've only kind of found that in the last couple of days, but your explanation has really helped. So I appreciate it.
Okay. And then the other thing to remember is there's 2 big tabs. The one is own time. So if you click on the week, it will show up as own time and real time. So like tonight, face-to-face is real time. So anything where there's face-to-face contact, that is real time. However, the majority of the time material is delivered online, and that will fall under own time. So own time means you can access that material whenever you want to. We normally, although we release the material on a week-by-week basis, we try to release it on the Friday before the next week, because I've seen that a lot of students actually work over weekends so that they at least have time to work through that material. We do try our best to do it, myself and Tony. Sometimes we just don't get to it on a Friday, but by the latest, it will be there Monday morning early. But the majority of the time on a Friday, we release it, and normally I send notification to say the material is now available. So most of the time, everything will be under own time. It's only when there's something face-to-face, which is very limited, where we then have under real time, that is face-to-face. Shangari, do you have any questions around that?
No, I think your explanation was very good. It helped me to understand how it works better. I
Yeah,
was
yeah.
figuring out a few days. Yeah, like I think yesterday I was trying to figure out. So yeah, it really helps me a lot.
Yeah,
Thanks.
the Moodle site is a little bit different this year than what we had before. So and that's why even with the assessment in the past, all our assessments came under an assessment tab. It didn't matter if it had a 0 weighting. Now, for an ISAP case where the one part is 0, it doesn't show, it only shows things with weighting. So that's why we always refer you to go to Getting Started, because Getting Started has everything. And when we talk about the ISAP case later, there's a Moodle book and there's even a direct link from the Moodle book to those submission drop boxes, but we'll talk about that later. Okay. All right. So I'm just
I
going.
think it's really important that you actually spend a little bit of time this week actually exploring the website, the Moodle site, and just sort of clicking on things and just sort of seeing what they do and where they go to. I mean, obviously you can't get all of the course information just at the moment, all the course material, I should say. All the course information's there, but you can't get all of the course material. And as the semester wears on, you'll become a little bit more used to the structure of that with Moodle books and things like that, that you'll become very familiar with that quite quickly. But I think take advantage this week of spending a little bit of time just sort of exploring. Really good idea.
Okay, thanks for that, Tony. Okay, so I'm just going to continue with the intro again. Just got to. Okay, so as you are aware, this unit sits within the grad cert with the code M4020, and this grad cert is really just concerned with X-ray image interpretation, so plain X-rays, and we will be covering the musculoskeletal system throughout. If you do all 40 units, and including the spine, the chest, and the abdomen for this unit. So if we go to the specific unit then for RAD5108. So this unit is concerned with the shoulder girdle and the upper limbs and the cervical spine. So that's the only anatomy that we will be focusing on in this unit. So everything in terms of assessments, in terms of case scenarios, in terms of exams, questions will only be focused on the shoulder girdle, upper limbs, and the cervical spine. We also apply clinical decision rules. So that's something that we will be working through with you. And then the other important thing is to measure your own accuracy. How well can you identify normals, and how well can you, when you see an abnormality, actually describe that abnormality as well. So we will be talking a little bit about that later as well. Another important thing is being able to appropriately communicate with other professions. So having the correct terminology so that when you do describe something that they understand what you are describing to them and that it is as accurate as possible. So that interprofessional communication is quite key. As Tony said at the start, you become a big component in the cog when it comes to patient care, and your knowledge can have a big impact sometimes on how a case is managed, especially when the radiologist is not around. So there's quite a lot of resources. So I've shown you the Moodle site and also highlighted the fact that material will only be released on a week-by-week basis. And then the Moodle books, which you will start getting next week. Not next week, because the clinical portfolio is presented also within a Moodle book, if I'm correct. But you'll get used to the fact that the majority of our materials are presented in Moodle books. And in that Moodle books, you will have either video recordings from myself or Tony. Tony does quite a lot of that. But when we do video recordings, we also upload the PowerPoint presentation to that. There will be links to sometimes to ebooks, but also sometimes to relevant articles. And then there might be some practice tests that we put in those Moodle books. I've shown you the reading list. The other thing I just want to highlight, and it's something new that we're starting this semester, and we're going to have one catch-up tutorial, so that will be face-to-face again, and that will be on the 11th of September and starting at 6:30 again. And the reason why we actually brought it in was we learned from RAD4502 that those who are not radiography trained, and we've got quite a few of other professions now being drawn to this course. So last night we had 2 paramedics, but we've had physiotherapists, we've had nurse practitioners, and even GPs taking the course. Now, with some of them that's not used to the radiographic knowledge, they did struggle. And for someone who's new to this type of structure and the way we assess at Monash and within the course itself, they can struggle. So this is a catch-up session that we arrange so that at that point we can talk about upcoming assessments, the exams that's coming up, and also if students have any questions, that's a time to come together and talk about that. Because quite often you might not think of something, but another student might have a question. Oh yeah, I did not think about that. So we've had with 4502, we just ad hoc catch-up sessions with them, which became actually quite valuable. And I thought we should at least have one for the other units as well. So that will be on the 11th of September. Now, the image manipulation software, and I think for that, I have a video clip as well. I'm not sure. I'm quite sure it's very similar to what you used to in the PAC system, but the image manipulation software allows you to zoom into the image, to take certain measurements as well, and to change the windowing, so that it's used in exams, and it's very useful, especially we don't always put things that's very obvious. We put cases in that can be quite subtle, so that you should be using the image manipulation software. So it's used in the ISAP case. We use it in formative exams, and we also use it in the final exam as well. So there is a video and demonstration of the software on the Moodle site. If you want to, we can do that afterwards. Just think about if you want me to show you the image manipulation software. Tony, maybe you can talk about this next slide to them.
Yeah, okay. In fact, I was just emailing Collective Minds Radiology, if you wonder what I was doing, looking at my phone. I wasn't just sort of deliberately being rude.
No, that's fine.
But Collective Minds Radiology is a very useful site for image interpretation, not only for radiographers. It's multidisciplinary, and really probably the major target is radiologists. But there's radiographers involved as well. And in fact, one of my ex-students is one of the applications people who's involved in Collective Minds. And that's who I was just emailing now, because over the last 6 months or so, over the last semester, we seem to have lost touch a little bit with Collective Minds Radiology, and that may be because my email address has changed and what have you, my circumstances changed. And so what I'm going to do this semester is actually renew that link, and you'll when I do, I'll actually let you know, so that you can actually go on to Collective Minds Radiology and have a look as well. It's sort of additional material. It's not directly involved, aimed at this particular unit or this particular course overall, indeed. But it actually contains cases. It's cases with, it's got a little bit of clinical history, and then it's got images, and the expectation is that you can get on there and actually interpret those images, and you can comment. So you can actually make a comment about what you think might be going on, what looks abnormal about the images. And the beautiful thing about it is that other people from all over the world, there's thousands of them now, can comment as well. I mean, some of the cases actually sit there and don't get commented on, but a lot of them do. And often it's, you know, radiologists from, I don't know, the UK, Sweden, all over the world, Middle East, probably Singapore as well, Shanghai, who actually go in and have a look at these images, and they make a comment. And then by doing that, you get the feedback. So you're actually able to go back in and have a look whether you were right or wrong. And you get to rate your confidence in actually giving an opinion and what have you. So it's a little bit of a bonus thing. And what I'll do this semester, you know, having, I think, neglected it a little bit last semester for reasons beyond my control, the plan will be that, you know, I'll go in and have a look at some cases. And if I find some good cases, I can flick them out to you and flick the link out to you and let you know, go in and have a look at Collective Minds Radiology at this particular case, which will be relevant to this unit. So it's obviously got to be upper limb, shoulder, or cervical spine stuff. The other website there is a useful one as well. It was actually put together by Ian Cowan, a radiologist from Christchurch in New Zealand, who I worked with in the past. Ian and I worked together in Fiji, teaching image interpretation to Pacific Island radiographers. And Ian created this website, which is actually directed at radiographers. So he's a radiologist, but he actually created this website for radiographers, particularly radiographers in developing countries, but certainly radiographers in Western countries can actually make use of it as well. So I refer to that, and even some of the material that I've used in developing lectures has actually been related to Ian and my stuff that we've done in the past. And so I acknowledge Ian in a few of the lectures at times where that's relevant. But I'd encourage you to actually go on and have a look at those two websites. But I think the internet overall is really very useful to you. There's a lot of stuff out there on the internet that you can make use of. In several of my lectures, I refer to websites. So it might be just, you know, there'll be a link as a reference, and you can click on that link and go directly to the website. In many cases, it's Radiopedia. I don't know whether you've actually come across Radiopedia before, but that's probably my favorite. It's actually got lots of great information, and also the guys from Radiopedia, the radiologists from Radiopedia, are very, very friendly and open to radiographers and other health professionals actually interpreting radiographs. And they actually run short courses as well, short workshops. So you'll see some of those advertised online, and they're well worth attending too. I've attended a couple of them in the past. And so look, I'd encourage you to actually explore the internet and make use of that. And, you know, when you do, if you're using it for your assignments, for your ISAP cases, then make sure you reference it correctly, appropriately, for the benefit of us all. And look, if you find some good websites that you know, you maybe think, oh, this is a bit obscure, people might not be aware of it, share it. You know, let us all know. That's always useful. So you can do that either via the forum, or you can actually send an email, and we'll send an email to either Imelda or myself, and we'll actually make sure it's circulated on your behalf. So yeah. Any questions about that? Happy with that? So I might just mute myself again, and I'll just quickly finish this email to Darren so that we can get back onto CMRAD.
Okay, thanks, Tony. Okay, so the next thing I want to focus on is the assessments. There's 3 assessments. So the one is the ISAP case that I've briefly mentioned. You've got an online exam, and then there is the clinical portfolio. Now, the ISAP case has a weighting of 30%, so the weightings are quite big. And as I mentioned, it has got 2 parts to it. There's a CAP report, and that is due on the 23rd of August, and then the comparative report is due on the 30th of August, and I will in the next slide talk about that a bit more. Then you've got 1 exam, so there's an online exam, and that will take place during the formal exam period of the university, so it will be on Monday the 28th of October. It covers basically all of the material that has been delivered in this unit. So it's quite a lot of material to cover, and it's a long exam. It's a 100-minute exam. I would really encourage you, if you can, to take the day off. It has a weighting of 40%, so it's quite a big weighting. So normally I make the exam available from 8 o'clock in the morning until 8 p.m. in the evening, so that students, if they can't get the whole day off, they can manage maybe a morning off or an afternoon off, or even before the exam closes. But you need to finish the exam before 8 p.m. And then there is the clinical portfolio, and that I will talk a little bit about more, what you need to do with the clinical portfolio. And that deadline is the last week of the exam period, which is on the Monday, on the 11th of November. And the material for the clinical portfolio I'll address next, and that weighting is 30%. Now, something that you might have noticed is that 2 of the tasks are competency hurdles. The ISAP case isn't a competency hurdle, doesn't have a competency hurdle attached, but the exam and the clinical portfolio, these have competency hurdles. What it means is you need to pass each of those tasks at a minimum of 50%. So say, for example, if you fail the exam at first instance, you'll get a second opportunity to do another exam, and that will be capped at 50%, and similar for the clinical portfolio. But although the ISAP case doesn't have a competency hurdle, it means you can fail it, but the weighting is actually quite big. So I would still encourage you to work hard on the ISAP case, because each of those carry weight towards your final mark for this unit as well. Then just a bit about academic integrity. You might have already received from the university, there's a compulsory module. So if you are not enrolled in RAD 4502, if you enrolled in RAD 4502, you might receive it under RAD 4502. But if this is your first unit, you will receive a notification that you need to complete a compulsory module around academic integrity, which has to do with plagiarism, collusion, and cheating. Now, the importance about this compulsory module, I don't send it out. It's centrally sent out to all students to complete. And there's normally a deadline to complete the module. It's very short. It's not something that's going to take you hours on end. However, if you don't complete it by the deadline, you might find that you can't log onto Moodle. So you will be kept out of Moodle until you contact them and do the academic integrity module. So if you get that notification, I would really encourage you to just do it, get it out of the way. It's not long, as I said, but it is something that the university, they I'm not going to excuse any student who's not doing the compulsory module. You only have to do it once. So if you've done it under RAD 4502, you don't need to do it under 5108. And then, as I mentioned, Learn HQ has got a lot of resources. So under that support tab on the Moodle site. So there's a lot about artificial intelligence and the use and how to references. And it's the AI is a beast that develops all the time, and it's the same at the university. So requirements are changing. Today there came another thing that there's now a new stuff that's been put on. However, for this unit, because we expect that you must demonstrate your own knowledge, your human knowledge, not a computer or an AI-generated knowledge, and skill that you have acquired in all three of those tasks, you need to do those tasks without the assistance of AI. I've talked about the special consideration, so I'm not going to talk about it more. So it's the SpecCon team that actually manages the special consideration. They will approve short extensions, but for the formal special considerations, they would normally contact me as well. Now, just briefly then about the ISAP case. Next week, you will actually get the Moodle book on the ISAP case, and I will provide a narrated PowerPoint on that as well. So as mentioned, there's two parts to it. And for this unit, the ISAP case is concerned with the cervical spine. So the first report you need to submit, which is called a clinical action plan. As I said, that's got the biggest weighting. It's 1,500 words. And then the second report is a comparative report, which has 500 words. Now, the university has a leeway of 10%, which means you can either have 10% less than 1,000 or 500 or 10% more. Stay within that leeway, otherwise you can lose marks as well. The weighting, as mentioned, is 30%. Now, because you are postgrad students, you're only allowed one submission. It means that when you submit your ISAP case, whether it's the CAP report or whether it's the CR report, it must be a final document. You can't put it in and then, oh, I need to still change something. You can't change it again. So it's a final document. So there's only one submission allowed. And when you submit the reports, it's submitted to what we call an integrated Dropbox. And what that also means is your report is then taken and is put through Turnitin software, which is a matching software that tries to identify if there's any evidence of plagiarism. So normally, if there is a plagiarism, it will highlight the passages that's been plagiarized. And the faculty has got, normally you'll get a similarity index after you've submitted your report. You also get that report with a similarity index that should not be greater than 15%. However, if it's greater than 15%, normally the marker will go in then and we'll go and have a look and see if there's true plagiarism. Sometimes students might repeat the whole questions in their report, and that, of course, picks it up and it matches it and is added to the matching as well. So do not panic if it's more than 15%, especially if you know that you haven't plagiarized, you've referenced properly, so then you don't need to worry. And then the ISAP submission boxes can be done via the getting started boxes or via the Moodle book, as I mentioned before. And as I've already said, the experts report then becomes available. And what you need to do with the experts report is to compare and contrast your CAP report with that of the experts report. So look for some of the strong similarities that you have with the experts report and identify any omissions, things that you haven't mentioned. So any differences. So you need to compare and contrast. And then we also expect you to write a few learning outcomes, stuff that you've actually learned through this ISAP case. And then also think about your clinical practice. How can you actually use that knowledge either for yourself or even for your team, because I've had students who actually write how they're implementing it. So using the case to the benefit, not just of yourself, sometimes of the team around you as well. So the ISAP Moodle book will be available next week. I've mentioned about the AI and then the submission dates. So for the CAP, that will be the 23rd of August, and the comparative report, the 30th of August. So that will be your first assessment for this unit. The online exam, as mentioned, is a competency hurdle. It's got a big weighting. It makes 40%. So all of the work that we present, and that's from week 3. Next week is the ISAP case, so that won't be included. So from week 3 onwards, up to week 11, all of that material will be assessed. And then what we do to prepare you, because it's such a big exam, we actually have 2 formative tests. So 2 practice tests that you're going to do. So in week 8, there will be 1. And then in week 12, which is the final week of the normal teaching period, there will be a second formative test. And these formative tests will help you to start to understand the types of questions that we're going to ask in the exams, the types of cases that we put there. So you'll be using the software in the exams. And what I normally do is I make the test available, and a couple of days later, I provide video recorded feedback so that you can self-mark your formative test as well. So the formative test then is computer-based, so it's run from the Moodle site. And then you have access to the image manipulation software. That will be on the 28th of October. As mentioned, the exam is 100 minutes long. So the exam opens up at 8 a.m. and this is now Melbourne time, so Australian Eastern Standard Time. So if you're in Singapore, you need to make sure that you've got the right time for Melbourne, and then it closes at 8 p.m. So if you start the exam quite late, say if you start the exam at 6 p.m., make sure that you can finish your exam before 8 p.m. because when it's 8 p.m., the exam automatically shuts down. So if you haven't completed your exam, you can't continue with the exam. You also only have, once you start the exam, you must finish it. So you can't start the exam and then decide, okay, halfway through, I need a break, I'm coming back and do the rest. You've got to do it in one sitting. So you're not allowed to stop and start the exam as well. I'm the main contact person when it comes to the exam. And the reason for that is because the exam is open until 8 p.m. in the evening. There's nobody else that monitors students from 5 p.m. onwards. So I'm the only one that actually monitors the students. What I normally do is I send an email about a week or 2 before the exam and ask students to let me know more or less their starting time for the exam. The reason for that is so that I can provide you with your login details. So you need to have specific login details for the exam on the Moodle site, but also for the software as well. That's different login details. The other thing is I need to know more or less when you're writing so that I can ensure that I'm available, that I'm at the computer. So if any student has an issue that I can attend to that because nobody else is looking after the students for these exams. So it's really important that students inform me. If you say you're going to start at 10 and something happens and you start at 11, it's not a big drama. It's just so that I know during that time I am available. Normally students will email me and say, listen, I'm going to start later as well. So if you start the exam at 8 a.m., I try to send all the passwords about a half an hour before the time. So if you start an exam at 8 a.m., I will send an email with all the login details to you about 7:30 in the morning. Yeah, so I think that's most of the things there about the exam. And then the next is the clinical portfolio. So that is due on the 11th of November. It is also a competency hurdle. and all of the material will be available under this week. So what you need to do is you need to start collecting cases, and it's all plain X-ray cases concerned with this unit. So it must be X-ray cases of the spine, the shoulder girdle, and the upper limb. So we expect a range so that you should have the shoulder, the elbow, the hands, the wrist, the forearm, the humerus, and the spine, of course, and a minimum of 25 cases. Now, the overall word count for each case is around 80 words. It makes about 2,000 words. But I tell students, don't stress, because some cases you write less and some cases you will write more. But it's really also important that you include normal cases as well, not just pathology cases. Because if you only have pathology cases, you can't really determine how well you are in excluding any pathology. And I'll come on to the self-auditing preliminary image evaluation record that we do. So make sure that you also have normal cases. You don't need to have half-half. Most of the time, students will have about 8 or 10 normal cases, and the rest is pathology. But also do not just have 1 or 2, because that does affect when you start to work out what we call the specificity. Each case is worth 4 marks, and as is 25 cases. So for the clinical portfolio, where you've got your clinical cases, the total marks for that is 100. You can use references if you want to support a discussion, but you don't need references actually. The second part of that, so that's the one part, is your clinical cases that you're going to write up, and I'll talk a little bit more about that. And the second part is what we call the self-auditing preliminary image evaluation record, and the marks for that is 20. So once we go through the clinical portfolio, you will see there's a table how you need to calculate the sensitivity, which is to do with identifying abnormal. Specificity is about identifying normals, and accuracy is your overall accuracy. And then we expect that you provide a reflection on your abilities. So you could maybe say, well, I'm so glad, I'm very good with this, but however, I struggle maybe with pediatric elbows or something like that. And then the other important thing is when you write your cases up, number each one, case 1, case 2, case 3, because when I review your portfolio, I need, if there's any of the cases that I need to draw your attention to, I need to know which case I'm referring to. So keep them in chronological order. They don't have to be all the cervical spine together, all the shoulders together. They can be in any order as long as you have them numbered. And then what you need to do is compare your comment or preliminary image evaluation you're going to write about each of those cases to that of the radiologist. And then you are going to assign whether it's a true negative or true positive. And as I said, we're going to talk a little bit about that. So in terms of the self-auditing preliminary evaluation record, remember, if the clinical question is patient has, for example, fallen, so it's related to trauma, and there might be some degenerative changes that the radiologist mentioned, which is not related to the clinical question, you can ignore that degenerative changes. The only thing that you are concerned with is the clinical question. Have you answered the clinical question? However, if you pick up something that's not in the clinical question, but is an incidental finding of importance, then you need to mention that as well. So as mentioned, you need to have the range of all of the body regions concerned with this unit. Remember, you need normal cases as well as your abnormal cases, and then you will assign true positive, true negative, false positive, and false negative. Now, sometimes with a case, there might be, for example, 2 pathologists, but you only identify one, and the radiologist has included an additional one. It means that you have only a true positive means you've identified a pathology. So you've only identified half of the pathologies, which means you have missed the other. So you've actually gotten what we call a false negative. So that's half a true positive, half a false negative. But each case must only be equal to 1. So that when you add your fractions up, that must be equal to 1. So in the end, if you've got total of 25 cases, your total should also be 25. And then you're going to calculate all of these sensitivity, specificity, and accuracy, and then the brief reflection on your ability. So this is just an example of how you would write up your cases. So for example, this is now case 12 in your series. So chronologically, you come to case 12, you identify the area. So you're looking at a forearm. The clinical indications is fall on outstretched hand. And then you should include at least one de-identified image. So please ensure that any images that you include in your portfolio mustn't have the patient's identification on. So make sure that they are de-identified. And then, so this is a preliminary image evaluation that was written. So there's a comminuted fracture to the distal radius with dorsal displacement and an associated ulnar styloid process fracture. When compared to the radiologist, so the radiologist identified it's a acute comminuted, but the other thing that the radiologist also mentioned is that it was intra-articular, which is quite a significant thing to pick up on. So that is something that was missed by this student who wrote the PIE. So for that one, the majority of the findings matches that of the radiologist. So true positive 0.75 and then false negative 0.25 for the intra-articular that was not mentioned. And that is how you should do each of the cases. So after you've compared and contrast, you need to include with each case this result and make sure that this adds up to 1. Okay, so I'm first going to stop share now. So I've gone through quite a bit of stuff there. Is there anything there that you have any questions on?
I've got one question just in regards to that last bit with the PI exams. So I had a case recently that I'd identified with the ED doctor after an older lady had a fush and she was tender on her wrist, but mainly over the ulnar side. But there looked like there was a lucency through the distal radius. And then there also looked like there was an abnormality through the carpal bones towards the ulnar side. I'd rang and flagged it with the doctor saying that like if this was the case, I would have probably said that I could see a lucency in the distal radius and an abnormality in the carpal bones. The report came back, turns out that the distal radius, where I thought could have been a fracture, was more age-related changes, but the carpals, which I initially thought may have been age-related, there was a very, very subtle fracture. This was after doing a CT. There was a very subtle fracture through the carpals. If I was going to say, it probably would be a negative or a half.
Yeah, that's a difficult one because on both sides you got it wrong. So so you got the fracture wrong and you identified a fracture that wasn't there. So for that one, you can't get a mark at all because you got it completely wrong. So that would be, it will be a false negative because you incorrectly identified, and it will be a false positive as well because you identified something that wasn't there. So it would be half false positive and half false negative. Does that make sense?
So even though there's abnormalities identified at both, because they were kind of swapped.
But what you had written was incorrect on both sides, so both would be then false. So it's you can't give a true positive because you didn't identify the pathology correctly, and you can't give it a true negative because you identified something that wasn't there. Does that make sense?
Yes, that makes sense. Thank you.
Okay. Shangari, any questions for you?
Yes, I do have one question. With I think the last slide from the second that you were talking about the true positive and the false negative. I just want to clarify at what point of time do we use 0.75 or 0.5? Because the one that the radiologist that pointed out the intra-articular, so if it's just like 1 point, does that mean we are 0.75 or like
Basically, you need to use your common sense, because if you look at that one, there's quite a few positive pathologies that the student correctly identified. So the majority of it was correct, however, missed out on intra-articular, which is quite an important thing to mention as well. So sometimes you might find that there might be three things. So you want to go a third, a third, a third. So it depends on the pathologies, how many pathologies there are. I just want to say with a third, a third, a third, and I've actually found it quite a lot in the last set of portfolios that I marked. So then students say 0.33, 0.33, 0.33, but it doesn't add up to 1. So yeah. So what I did say to the students, so if the question is there a fracture, you identify just put the 0.34 at the one that makes the most sense. So that when you add up, it adds up to 1, because in the end, when they add it up, then they don't have a full 1, and you need to have, it must be equal to 1. Yeah, so that's what I would say. So it really depends. Sometimes you might have 4 things. It really depends on what you are picking up and how it is related to the radiologist. So for yourself, just use your common sense. You know, if you know, okay, I've identified most of it, but there's just one thing that's really important, and I think that makes about 25%, then yeah, that's what I would do.
Okay.
All
So
right.
it's really, I think, up to you to actually decide the weighting.
Yeah.
Yeah.
Okay.
So you could, like in that last example on the slide, it could have been 0.8, 0.2.
0.2. Yeah.
Yeah. And that would still add up to 1. But yeah, so that might be the way that you perceive it. Certainly, intra-articular fractures are important. But, you know, you might decide that it's only worth 20% rather than the
25. Yeah.
Yeah. The other thing that I just wanted to mention is, look, in relation to calculating your accuracy in the clinical portfolio. If you're doing 4502, there's actually a component of 4502 that is on the measurement of accuracy in radiology. But if you've actually not done 4502 yet, you'll find that there is actually a lecture. It's actually a scroll through lecture, so there's no voiceover, which is actually it's been repeated from 4502 across the other units where there's a clinical portfolio, so that you can actually look at that lecture if you haven't done 4502.
And that's available under this week as well, Shangari. So you will see that. Yeah. So you can go over that.
Or the other thing is yell out, you know, send an email and say, hey, look, I'm stuck. I don't know how to calculate, you know, specificity or something. But if you look at that lecture, that scroll through your lecture, that actually does tell you how to calculate these things to create a contingency table, and which is an important part of things. I mean, chances are you've actually done it at undergraduate level anyway, that you would have done some stats in the past at some point, but you've probably completely forgotten that. So, as we tend to do with statistics. But yeah. So the other thing that I just wanted to mention in relation to the clinical portfolio is like how to come up with your normal cases, or how to choose your cases, if you like. In some ways, like there's always going to be the temptation that, you know, you're going to actually choose choose your cases with a bias, if you know what I mean. So you'll choose the cases that you felt that you knew best, and you'll actually ignore those cases where you didn't feel competent, and you'll let them slide through, without actually including them in your portfolio. I mean, and a way to actually avoid that is to actually set aside, like you might set aside some days when you're actually working in general, and every upper limb case that you actually see go through that day, you're going to choose those cases so that you're not introducing your bias. You're choosing all the cases within a particular time period, be they normal or abnormal, be they, ones that you feel confident with or ones that you do not feel confident with. And that way you actually, I think, a little bit less inclined to sort of be a bit picky about cases. So think about a way that you can actually, I mean, not randomly, I mean, that's not randomization, not by any stretch, but that you can actually select cases without introducing a bias yourself. It's always a risk, and it's understandable. The other thing, if I could just take a couple of minutes, is just to mention that, mention cervical spine. Look, as Emel has already referred to, the ISAP case is actually a cervical spine case, which actually includes plain radiography. Now, we are not stupid. We are not naive about the role of plain radiography of the cervical spine, in that we very rarely do it in this day and age. Patients will actually bypass plain radiography and go straight to CT in probably 95, maybe 99% of cases. They'll actually, but there is a potential role for plain radiography of the cervical spine, and I think it doesn't hurt for you to actually learn about plain radiography of the cervical spine. So there's a lecture on plain radiography. The ISAP case does include plain radiography, but it actually overlaps into CT as well. So it crosses over the boundary into CT of the cervical spine. And the other thing about looking at cervical spine cases, or how to interpret radiographs of the cervical spine, is that there's a whole lot of generic skills that you obtain in doing that. And it's dealt with largely in the ABCs approach to interpreting radiographs, which you'll become familiar with if you're not already. But there's like some generic skills that you need to gain. They might be sort of broadly stretched across plain radiography of various body parts, including cervical spine, but also fingers, hands, wrists, forearms, elbows, shoulder, you name it. And so it's partly about not just being able to interpret cervical spine plain radiographs, but also about acquiring some of those generic skills in radiographic interpretation. So don't be put off by the fact that there is cervical spine in this, and you probably haven't seen a plain X-ray of the cervical spine for, many weeks, if not months, if not years.
May we just ask, Lauren, when last have you seen plain X-rays of the cervical spine?
Very rarely. I think even a lot of the cases that have come through recently, they may get changed from an X-ray to a CT because they're all kind of disc bulge and nerve impingement kind of questions. So maybe one every couple of months.
Okay.
Yeah, that's certainly been my experience.
And Shankari, for you, what's the situation for you?
We have more neck soft tissues as compared to C-spine. mainly because for pediatric, we are assessing for adenoids, but the only time where we do see spine would be during trauma radiography. Most commonly during trauma radiography, yeah,
Okay.
in emergency settings. So I guess it's hard to say. It could be a few times a month or seasonal. It's pretty seasonal. Sometimes you do get like every week. So,
Okay.
Yeah. I mean, having said that, we're sort of having a bit of a peripheral discussion here, but the ISAP case that you are given in the semester is actually a real case where there was actually plain radiography performed in the first instance on the patient, and it was something of a fallback because the patient wasn't suitable at the time for CT. But it does raise that sort of question about, is the cervical spine plain radiograph actually going to work its way into your field of view at some time? And, they occasionally do. But just don't forget that it's about generic skill development and those sorts of things as well. And don't sort of get hung up on the idea that cervical spine, you've got to be kidding. It's a bit the same with abdomen as well.
Yeah.
The number of plain abdos that we do these days is very few. Even erect and supines, we don't do those anymore. Well, we probably shouldn't.
I think still when I ask the undergrad students, a lot of hands still go up that they've seen it.
We do a fair bit where I'm from.
Yeah. Listen, I just want to, because I've still got a presentation on the clinical portfolio, I quickly want to go through. So what I'm just going to start